Oh, perfect. Hi, Rosa.
Hey, how are you?
I'm good. How are you?
I'm good. Oh, I look so nice and bright where you are.
Yes, yes. Really bright here. We're at noon instead of 9 your time.
Oh,
Um, Hopefully my connection is okay. We'll kind of keep it, go with the flow. Can you hear me okay?
yeah. No, you're fine. I know with that outage, it's crazy.
I know it's affecting like my internet, my phone, so we'll see how this goes, but hopefully the connection will be okay for the duration of the live today.
Yeah, we'll do as much
Okay.
as we can.
Amazing. Amazing. Well, we can let a couple others join and then we'll get started. And even if, again, less people are able to join, they'll be able to watch it back, which is great. We'll have that resource up for them to be able to take a look at it on their own time as well.
Yeah, that's perfect.
Perfect.
Um,
Okay. Should we get started with introductions? We can both introduce ourselves and then maybe people will be joining in as we can get into the topic a little bit for today.
I'm Rosalie. I'm the owner and family consultant. So I essentially work with families all over the world to help get your child, baby, toddler sleeping better through the night and making sure that your family is well rested.
Amazing, amazing. And my name is Bradie. I'm the dietitian. I work with Push Mama Care, where I specialize in perinatal nutrition as well as pediatric nutrition as well. So overall at Push, we're a team of interdisciplinary health professionals where our goal is really to make moms or families feel as supported as possible in their prenatal or perinatal journey and going into taking care of their little one. So my role as the dietitian, I work with moms or families to help make sure that they are getting everything that they need through their perinatal journey, as well as with their children once they enter into that phase of parenthood as well.
Awesome. Oh,
Amazing.
so should we get into kind of that connection between sleep and nutrition? Sorry, Brady, you're just
Sorry, it's a little my connection definitely is not good. There's a bit of a lag, so just bear with me if I'm start talking over you or I'm so sorry. Yes, if you want to go ahead and start with the
yeah.
connection kind of between sleep and nutrition.
Okay,
Sure.
so
Yeah.
I mean, at 6 months, most babies, if they're healthy and they're kind of growing on their growth curve, biologically, they don't require a feed overnight anymore. So, really, when we're looking at that connection between sleep and nutrition, we want to ensure that babies are getting about 24 to 32 ounces of milk in a 24-hour period. So, if your child is able to get that in during the daytime, then overnight, they probably don't require a feed anymore. Around 6 months, it's a super common time to see sleep disturbances, oftentimes due to developmental milestones. Okay, so your little one is developing super rapidly at this age, and we can see some setbacks in sleep. What happens is when we see those multiple night wakings due to those developmental milestones, as parents, we can often quickly intervene and our baby hungry, which is a fair assumption. So that's where it's really important to be looking at that daytime intake to see where those wakings are coming from. Okay, so if we're jumping to the conclusion that our baby is hungry with every night waking and offering those feeds multiple times through the night, over time, your baby may be waking from habit rather than a need. All right. So if this isn't working for your family, what I usually recommend is to follow a routine to your day that looks play, sleep. So essentially, where that helps is that you are offering a feed to your child once they wake up from a sleep. So they will be rested and they will be alert, ensuring that they're taking a full and effective feed in. And again, focusing on the time intake as opposed to that overnight. This also helps to reduce the feed to sleep association, which is simply your baby who is using feeding as a cue for sleep. And we can get a bit more into that later on. So, so that's kind of the connection from my viewpoint. Brady, do you have anything to add to that?
Yeah, yeah, absolutely. Well, I think to kind of summarize how I see it as well is the fact that routine has such a big role in terms of a baby's consumption. So overall, when someone's sleep routine or a baby's sleep routine is having challenges, it will also affect their appetite and their acceptance, especially around the 6-month age, their acceptance of new foods. So we want to be introducing foods when baby is happy and in a good mood so that we create that positive association. And when you have a tired baby whose sleep is not necessarily going very well, it's going to make that introduction phase really challenging too. So overall, it can affect introduction if sleep is a little bit off. And then it also can create changes in your baby when we introduce foods that can in turn affect sleep as well. So whether we are introducing foods and it's changing their bowel routines, so you might notice changes to their bowel routines with food introduction, and that can have an impact on sleep as well and wakes throughout the night. Whether it affects energy levels, and maybe there needs to be again some adjustment in that routine so that exactly how Rosa said, I love the eat, play, sleep, because then the changes in energy from introducing those solid foods won't have too much of an impact on sleep. So there's definitely a connection here. And if one is off, or if you're having challenges in one area, you might be experiencing challenges in the other as well. So they're two really great areas to kind of be addressing together, which is why we're really excited to be talking about some of the most common questions that we get for sleep and nutrition today for your 6-month-old baby. We're going to be talking about some really common questions that we get, and then we're going to be making sure that we answer as many of the audience questions that we got as well.
Yeah, awesome. So we'll answer those questions ahead of time, and then if any of you have questions live, please submit them, and we'll try to answer them for you this morning. So some of the most common questions I get with baby sleep around 6 months is really around that general sleep need. So how much sleep does my baby need in 24 hours? So when we're looking at a 24-hour day, we're looking for about 12 to 15 hours of sleep in that 24-hour period. 10 to 12 of those hours we're looking for overnight, okay? During the daytime, we're looking for about 3 hours of sleep split into 2 to. This is also a very common time for a nap transition, which can also present with some sleep disturbances as we're navigating that. And in terms of that wake window, so wake window is, again, just the wake time that your baby can tolerate between 2 sleep is about 2.5 hours, right? So from the time that you pick your baby up from the crib to the time that you're putting your baby back to bed is that way. So that's kind of the most common kind of education that I address with babies of 6 months old.
Amazing. And with that, so you mentioned the wake windows for a 6-month-old. Can you tell us a little bit more about what to kind of expect with those wake windows throughout the day? You mentioned that there would be a few hours of sleep throughout the day broken up, but what do the wake windows commonly look like for that age?
So about 2.5 hours. Okay, so let's say your baby is up at 7 a.m., for example. Then you would get them up. About 10 to 15 minutes later, you would offer a feed, have some playtime, and then 2.5 hours after that, around 9:30, you'd be putting baby back down for a nap. Okay, so again, some babies on 2.5 hours and start to stretch to 3 hours, and that's why with that lengthening of wake windows, we tend to see the transition down in naps around this age, around 6 to 7 months. We can see babies going from 3 naps a day.
I feel like the transitions of sleep are something that can be such a challenge because parents don't really know what to expect, especially when it is their first child. So that is great to know those kind of rules of thumb that parents can look for and apply as they're kind of working into this routine with their little one. That's amazing. And another question that I get that's kind of related, but I was wondering if you could speak a little bit about whether or not at the 6-month age, babies are biologically able to sleep through the night. And again, that's kind of a transition period. We hear a lot about, whether or not kids can sleep through the night at that age. So what are your thoughts and opinions on that?
Yeah, so kind of like I mentioned in that intro part, at this age, if your baby is a healthy weight, and it's always great to talk with your family physician just to confirm if you're unsure, make sure your baby's on their growth curve. But generally speaking, most babies at 6 months are able to sleep through the night with a feed, as long as we are making sure to get in those feeds during the day that are full and effective for reaching that 24 to 32 ounces that we're looking for. So it can be, yeah, a tricky thing to navigate. So definitely lean on resources around you, reach out to us with questions, and confirm with your family physician to make sure that your little one is growing properly on their growth curve. And if so, then start looking at what could the other be that are causing these night wakings. Does that make sense?
Yeah. Yeah, absolutely. Absolutely. And I think that's something too that, you know, a lot of parents, we hear a lot about sleep training and working towards having our babies or toddlers sleep through the night. And overall, at this age, it is really important to consider, okay, are they getting enough throughout the day? Are they meeting their nutrition needs that you can't take away that night feed? It's not so much to just are they biologically able to, that's really important to know, but it's also, okay, is your child getting enough throughout the day and are they growing okay to take away that kind of nighttime feed?
Yeah, 100%. It's really, really important. Yeah. Yeah.
Amazing. Anything else that you wanted to touch on in terms of common sleep questions before we talk a little bit about intro to solids?
I mean, I could go into a lot, a lot more, but I think I might say for another day. That's kind of a general overview of 6 months sleep. And then, you know, maybe if people have other questions, then we kind of go from there to answer those specifics around this stage. So when looking at solids, Bradie, one common question I get a lot is when should we be introducing solids?
Yes. So overall, the recommendation with introduction to solids, it changed within, you know, the last while. And it used to be that it was recommended to introduce around 4 months. And now the recommendation is to introduce in and around the 6 month period. So overall, around 6 months, even, you know, a little bit before, a little bit later is typically the age that we would be looking for. But we also really want to be looking for those individual signs of readiness in our baby as well. So signs of readiness are really important to be keeping an eye out for. Anything from the fact that your baby has good head and neck control so that they're able to turn their head away if they're feeling full, if you're offering food. So really good head and neck control, that they can sit upright for the duration of a feeding period is really important. Generally, we say that you want to look for that they can stabilize themselves and kind of lean forward as well in the high chair in case of any sort of choking as well. So the fact that they can lean forward in the high chair, and the fact that they're starting to show interest in foods is really important as well. So if your baby is starting to reach for your foods and trying to put things in their mouth a lot, then that can be another sign that your baby is ready for solids. So you really want to be looking for all of these signs, and typically we recommend in and around 6 months. Every baby is different. So if you feel that your baby is not showing these signs around 6 months, or you feel like they're showing them earlier, it's really important to talk to your healthcare providers as well and just get their opinion on whether or not your baby might be ready for those solid foods.
Oh, amazing. Can I ask a follow-up question on that? So you mentioned if a baby turns their head, that's a sign that they're full. Can you elaborate? Can you tell us a bit more about that?
Yes, yeah, I would love to. So overall, we want to do our best. Babies have amazing hunger and satiety cues that all of us as adults, our hunger and satiety cues have been impacted by so many different things. And babies have really, really in tune cues with their actual physiological needs. So we want to do our best to kind of foster those as we are introducing solid foods. So when your baby is refusing to eat, when they're turning their head away, of course, there can be reasons other than satiety. If it's a taste they don't enjoy, if it's a texture they don't enjoy. But overall, we want to do our best to try to foster those really good physiological hunger and satiety cues. So when your baby is turning their head away, we generally say, okay, that is a time then that, you know, they may not want that food, they may be feeling full, and you don't have to kind of continue pushing that food. I know that a lot of parents too, out of concern that they want their child to be eating enough, we will be kind of inclined to nudge that food a little bit more, you know, maybe make some airplane sounds, maybe make that food sound enticing. But overall, we want to try to listen to those kind of satiety cues that they might be telling us.
Right, and really honor what they're yeah. Oh, that's interesting. I feel like we definitely were, you know, maybe weren't super aware of that with our kids. So very, very cool to know. So let's say a family, you know, says my I think my baby's showing these signs of readiness. What would you usually recommend as first foods to introduce?
Yes. So first foods that we want to start off with introducing would be our iron-rich food options. So around the 6-month mark is when a baby's iron stores, they're built throughout pregnancy and they start to be depleted around that 6-month mark. So iron-rich foods are our first option. And overall too, a baby's iron needs significantly increase at 6 months. So we really want to make sure that we are meeting those iron needs through food. Everything else your baby can continue to be getting from breast milk or formula. So overall, iron-rich foods are our priority. So that can be anything from a fortified iron-rich cereal, an infant cereal. It can be anything like any sort of meats, whether it is a chicken, beef, pork, any type of meat that your family is eating and enjoying. Whether it's something like eggs or a meat alternative as well, like legumes like lentils, beans, chickpeas, tofu, tempeh. Any of these options are really, really good iron-rich foods that we want to start off by introducing so that we are really supporting meeting a baby's iron needs. So those are our priority. And anything else that we're introducing after iron-rich foods, around the 6 to 9 or even up to a year, it's a lot of experimentation. It's a lot of developing taste preferences. Most of their nutrition is still going to be coming from breast milk or formula. So overall, iron-rich foods are a big, big priority here.
Amazing, amazing. So I do have another follow-up question. Conversations I have with clients and families and stuff. So in terms of, let's say, your baby's 6, 7 months, you've started introducing solids.
Yeah.
So looking at solids and sleep, for example, I think a lot of people get feedback that, oh, my baby or your baby enough solids, so they're going to sleep badly at night. So my understanding is that primary source of nutrition continues to be breast milk until about 12 months of age. Can you tell us a bit more about your viewpoint on that?
You have it exactly. That primary source of nutrition is really going to be from breast milk or formula. And overall, baby's energy needs are going to be met through that. So something I do hear a ton is parents were concerned about their child's intake anywhere from the 6-month to the year mark of solid foods. They're specifically concerned, like, my baby isn't eating enough solids. And every baby is different. Every baby is going to have preferences to different textures, different tastes. So as much as there are strategies that we can encourage to help with introduction to solids, overall, your baby's primary source is still of nutrition is still the breast milk or formula. So if there is a feed that is missed with introduction to solids throughout the day, I really wouldn't expect that it would be what would be affecting sleep. Their main energy needs are going to be met through formula or breast milk, unless of course their intake of that would be low, in which case we'd want to kind of evaluate that and see what might be going on as well. But overall, if they are having their regular amount of breast milk or formula throughout the day, and you miss that kind of introduction of solid foods or that solid food meal throughout the day, I wouldn't anticipate that it would affect their sleep too much.
Okay, perfect. That's super helpful. And another question I commonly get asked, are there certain foods in a diet for a child or baby that can help promote sleep?
Yes, really good question, and a really common one that I get as well. Overall, there's not a lot of research to support that specific foods really help to improve a baby's sleep. There are a lot of kind of anecdotal answers out there that you might find, whether it's things like cherries that contain melatonin or high magnesium foods. So there are kind of anecdotal foods out there. There's not a lot of research to say, yes, these foods will help with baby sleep. So what I actually recommend doing is doing a little bit of journaling around the foods that they're having. If you're really kind of thinking that you want to establish this pattern of what foods will help, you might do a little bit of journaling on the nights where you notice that your baby had a really good sleep. And then if you want to try maybe the foods that you offered on those days before their sleep periods, then you can always see if, okay, they had banana on that one day before sleep and they slept really well, and I'm going to try that again and see if they have another good sleep. And then you can start to notice kind of individual patterns, but there's not really research to say that certain foods are really, really helpful for baby sleep, guaranteed, if that makes sense.
Right. Yeah, totally makes sense. That's super helpful. Thank you, Bradie. Okay, anything else that you want to touch on in terms of general nutrition at this age?
No, I think that covers pretty much the basics for 6 month introduction. So we can go and talk about some of the amazing audience questions that we got in through our social media.
Yeah, so I'm just going to take a look at those. So we got lots around nutrition. Um, so the first one is a 9-month-old teething and refusing to eat solids. He only eats fruit for about the past 2 to 3 weeks, I think, if I'm interpreting that right. Um,
Okay, okay, yes.
so refusal of solids, only eating fruits.
Yeah, absolutely. And this is something, again, it can be a really common experience. And as a parent, it can be really challenging. It can be really frustrating. Again, out of concern, we want to make sure that our baby is meeting their energy needs. So, the first thing, again, around that 9 month period, I always want to set a parent's mind at ease that your baby is still going to be getting most of their nutrition from their formula or from their breast milk. So, overall, first things first is we want to give ourselves a little bit of reassurance that if baby is having breast milk or formula, they're getting most of their nutrition needs from that. The other thing that we can keep in mind is that overall, aside from teething too, is that babies can have different preferences, and sometimes similar to sleep and sleep regressions, we can kind of have feeding regressions as well, where they start to refuse certain foods or they start to prefer certain textures, and really that is also very, very normal as your baby is going to be developing these lifelong preferences, or preferences that will change. But overall, even as adults, we all have preferences, if that makes sense. So
Yeah.
what we can do with that, overall, we want to be encouraging those iron-rich foods as much as possible. So what we talk about doing is some repeated exposure. Babies and toddlers can refuse foods, and sometimes just reoffering those foods and not feeling really discouraged if they're refused a few times can be helpful, because sometimes with foods, we say that it takes 8 to 15 times of offering a food for a baby to really truly accept that food. So it can take a lot of repeated exposure. So it's hard to say if they were accepting those foods and they started refusing them versus whether or not they've just never accepted those foods. It's a kind of a different answer. And then if you notice too for teething, you might try temperature differences sometimes can be helpful as well. Like sometimes cold temperatures can be soothing for that. So even changing temperature differences of foods may make a difference in their acceptance of those foods.
Amazing. What a great answer, Brady. Amazing. Okay, the next question is it normal for a month old to still wake up during the night for feeding? So for me. So absolutely, yeah, 4 months old, it is very, very normal for a baby to wake up to feed. Their tummies are still pretty small. So if your child still wakes up overnight and takes a bottle or some or feed at the breast, totally fine. What I would encourage you is to look whether there is a feed to sleep association. So if you are to encouraging your child gently to stretching their night, eventually sleeping through the night around that 6 month mark, hopefully, just making sure that the feeds you offer overnight are done in a way that's going to promote that independent sleep. So that would look like getting your baby up out of bed, giving them a little cuddle, maybe doing a diaper change to wake them up a little bit. Sometimes having the pajamas open to keep some fresh air on them can help keep them awake for that feed. Really, it's about keeping them awake for the feed. Again, ensuring they're getting a full and effective feed so they're filling their belly well, and then putting them back into the crib awake so they are aware of their surroundings. Okay, what happens with that feed to sleep association or any sleep prop that is used is if you're looking at sleep as a journey from point A to point B, and let's say you are feeding your child to sleep, you're completing that journey from point A to point B for them. Then you're putting them in their crib. When they wake up between sleep cycles, because we all wake between sleep cycles, as adults, we can do a quick check of our environment and we realize it's where we fell asleep in, we're comfortable, we're safe, we roll over and go back. And often we don't even remember having those wakes. For babies, if their sleep journey has already been completed and then they are put to bed, when they wake between these sleep cycles, they do a quick assessment of their environment and they say, this is not where I was when I fell asleep. And they wake fully and ask for you to come back and help them to go back to sleep. So in terms of that night feed, 4 months, absolutely give that night feed. just make sure that baby is going back into their sleep space, awake, aware of their surroundings, so that if they have another waking, or when they have another waking between a sleep cycle, they can do a quick assessment of their environment, say, this is where I fell asleep, I'm comfortable, I'm safe, mom and dad will respond to me if I need, they can flip over and go back to bed.
That is such an amazing tip, because again, it's not something that we, I think, talk about it so often. You know, we may have that nighttime feed and we let baby fall asleep while we're either feeding or, you know, while they're in our arms, and then we put them back in asleep, and it makes sense as to why that might be alarming when they wake up. So that's such an amazing strategy that I think a lot of parents don't hear about a lot.
Yeah, and I always love to say, like, if that works for you, if you know your baby falling asleep, it can be a really special moment for a parent and a child to have them fall asleep in their arms. And if that works for your family, that's fine. Keep doing that. It's if it's
Right.
becoming a problem for you, you are looking to make changes, and that's one way that you can start to make those changes. For sure, yeah. So the
Yeah, and I think
next,
that also,
sorry, go ahead,
sorry, our
Bradie.
connection just lagging a little. I was just going to say, I think that we can also apply that to so many things. You know, a lot of things, it's trial and error, because every baby and every family is different. So it is
Yeah,
some trial and error, and what works for one family might not work for your own. So if something is working well for you and it's safe for yourself, for your baby, then fantastic.
yeah, yeah, for sure. I think that's a really important message, and I think you know, training or sleep teaching can often get some negative views. It's often associated with night weaning, and that's another message I just want to get across to everyone is that you can still teach how to be an independent sleeper and have that healthy sleep foundation without night weaning. We can absolutely have the two going. You know, you can have a night feed and a good sleeper as well. Oh, so the next one, Bradie, is you. Nursing strike repeatedly since starting solid, almost 7 months old.
Sorry, I missed the first bit of that as it cut out. Do you mind repeating that?
So a nursing strike repeatedly since starting solids, and the
Nursing
baby
strike.
is almost
Yes. Okay. Okay. So this is something that it can be really, really individual. And so it's really important that you're maybe working one-on-one with a healthcare provider, whether it's a dietitian or a lactation consultant, or someone who is in this field that might be able to give you one-on-one support, because it's something that can be really, really individual. Overall, the first priority is, how is baby's growth? We want to make sure that baby is growing well, and that is kind of the first priority. The second thing is that with any sort of nursing strike, with introduction to solids, there may be some preference for solid foods as well. So as I mentioned before, we want to remember that every baby has maybe textural preferences or taste preferences similar to we would as adults. So there might be some preference to solid foods compared to liquids. So there might be some preferences there. The other thing that we want to kind of be mindful of then is how much of the solids we're offering. So sometimes too, when we're offering too many solids, or too much solid foods, it can affect baby's appetite to be accepting breast milk or formula. So we might want to look at how many times solid foods are being offered throughout the day, what those types of timings look like in comparison to when you're offering breast milk or formula. And overall, we want to make sure that we're not over offering solids so that it's affecting their appetite to be accepting breast milk or formula, if that makes sense. If they're filling up on solids, they just might not have appetite. So it's something that it's a bit of a hard question to answer. But speaking with your individual care provider, or even sending me a message after with a little bit more information, I definitely can do my best to give some guidance. It's something that can be a really big challenge. Again, we want our baby to be fed and healthy and growing, and when they're refusing the breast or bottle, can be a big challenge. So if anyone wants to send me a message after with a bit more specifics there, I might see what I can do to give a bit more specific guidance.
great. I just wanted to follow up too on you mentioned kind of sometimes if too many solids, they can show a preference to that. So at 6 months, how frequently do you usually recommend offering solids, or 6 to 7 months?
Yes, generally 6 to 7 months, you might be offering solids 1 to 3 times in the day. Depending, again, every baby is different. So depending on your baby, if they're more inclined to solids, you might be leaning towards 3 times in the day. If they're less inclined, you can stick with offering one in a day and know that their main nutrition is going to be coming from that breast milk or formula. So 1 to 3 times in the day around this age. And the amount, we have to keep in mind that baby's stomach is really, really small. So the amount can just be anywhere from, 1 to 3 teaspoons. It really will depend when you start off, just a very small amount because baby's stomach is really, really small. So it's easy to fill up on solids, and overall 1 to 3 times in the day would be a good amount to start with.
Okay, that's great information. Is there a time of day that you recommend kind of introducing solids, or offering those solids throughout the day?
Yeah, good question. So there's no specific time of day that we recommend introducing solids overall, or that I personally recommend. Overall, the most important thing is that your baby is in a healthy and happy mood at that time. If your baby isn't feeling well, if they're tired, if they are just a bit fussy, then it's a lot more likely that they're going to show refusal to those foods, or maybe develop some negative associations if we're consistently offering at times when they're not in a great mood or they're a little bit fussy. So the most important thing really is that we're offering when baby is happy and in a great mood and really alert and awake. And then we're a lot more likely to get positive associations with the foods that we're introducing, with solid foods in general. So not so much a timing, because again, every baby is different. So I hear a lot of the times, is morning the best time to introduce? And if your baby is less alert in the morning, if they're a little bit sleepy, if they are less of a morning person, so to speak, then it's not necessarily going to be the best time to introduce. So try to notice when your baby is really in that happy and alert mood that you can offer.
Interesting. And it brings back that kind of that having a well-rested baby, and this introduction to solids. Very neat. Okay.
Yeah.
The next question I love. What is your opinion on gripe water? Baby gets a lot and it affects gripe waters to help. Is it going to affect her stomach's ability to produce mass? So that's something that we often see as people, using gripe water with their babies. What are your thoughts?
Yes. Yeah. So first of all, gripe water is something that is a more kind of traditional approach, in terms of, it's not something that we maybe have a lot of research on. We don't have a ton of research on many herbal supplements or. Oh.
Bradie, sorry to interrupt. Do you mind just explaining for people what gripe water is, in case someone doesn't know what it is?
Yes, great. Thank you so much for grabbing me there. Yes, absolutely. So gripe water is a combination of sodium bicarbonate and herbals. So anywhere there might be things like ginger, lemon, dill, different herbal supplements in this, chamomile, different herbal supplements can be in this water. And it's really kind of traditionally, again, it's from a traditional approach, maybe used to offer to help ease stomach pain, any sort of tummy troubles that your baby might be having. But it's just something that we don't have a lot of research on. A lot of herbal supplements or uses in infants. So it's not necessarily my first recommendation, but I definitely understand that when a parent is using it and they're noticing that their baby is doing better and their bowel movements are more normal and that their baby is feeling better, I absolutely understand the inclination to use it. The first thing that you want to look for, every product is different. So some of them can actually contain some alcohols and some of them can contain added sugars. So you want to look at the ingredient list to double check that if it is a safe product to be offering your baby. And then overall, I personally recommend working around some other kind of routines before turning to an alternative that we don't know a lot about the safety of. So anything from infant massage, anything from changing routines of feedings, anything around looking at mom's diet and seeing is there anything that we can make changes with. So I recommend those things first. And then if you do decide that gripe water is something that you'd like to try, I always encourage discussing it and the specific product that you want to use with a healthcare provider on your team.
Right, right. That makes a lot of sense. And do you know if it would affect long term the stomach's ability to produce acid?
You know what? That's a really good question, and it's not something that I've ever seen out there that it does affect long-term ability. Generally, our bodies are super adaptive. So overall, a lot of things that we kind of use as these tools, when we take them away, our body will kind of become accustomed to kind of going back to its usual. But it's not something that I've heard about, and it's something that again, if anyone wants to send me a message, I can look into that and give you a better answer there. I haven't heard about long term affecting the stomach acid production.
Okay, okay, amazing. So just to recap, not your first choice, try alternatives.
Yeah.
But if you do decide to go that route, just talk with your healthcare professional and make sure that the specific product you're planning to use is okay to be using with your baby.
Absolutely, absolutely. You got it. A lot of these questions and concerns, it's so great when you can speak one-on-one with a healthcare provider that you trust. So
Yeah.
definitely, if there's someone on your team that you can ask a bit more specific to as well, then that's amazing, so that you feel comfortable and you get a good answer tailored to you.
Yeah, yeah, wonderful. So those are what were submitted ahead of time. I'm just going to take a quick look if we missed anything in that. If anyone submitted. Here's one. So should we be introducing allergens also? How should we go about it?
Yes, that is such a great question. Introduction to allergens is like a whole Instagram live on its own, but just to give a little bit of information, we know that early introduction to allergens can actually be really helpful in reducing likelihood of developing food allergy. So right around the 6 month mark, when you introduce solid foods, you can also start to introduce allergens. There are about 9 common food allergens that we refer to, and overall, there is a really specific way that we want to be introducing them. So we want to be introducing them one at a time, in certain amounts as well, again, so that we are making sure that if baby does have a reaction, we can identify what allergen that's coming from. So we don't want to introduce 2 at a time, then we won't know what causes a reaction.
Right.
So we want to introduce allergens early on, around that 6 month mark, one at a time. And if your baby is at a higher risk for food allergy, so for example, if they have a family history of a food allergy to a common allergen, like a parent has an anaphylaxis to nuts as an example, if baby has any signs of eczema or asthma, they are also at higher risk of developing food allergy. So at those times, again, it's really important that we follow the really specific steps for introduction. And again, a registered dietitian or healthcare provider can help to guide you through those steps for sure.
Okay, amazing. I have one more to add, something that I commonly encounter as a sleep consultant. Middle of the night poop. So often we can see babies, that are really sleepers, and then they go through this phase of 3 a.m. They start waking up with a poop in their diaper, really interrupting their sleep, and families are having a hard time kind of navigating that. So would changing the timing of solids help with that?
Yeah, that's a great question. That absolutely can help. And it will kind of depend on the age. Because again, if we're looking at the 6 month mark, when we might only be introducing 1 to 3 times in the day, then definitely we have a lot more flexibility as to changing. So if the baby is around 6 months and we can offer solid foods sooner in the day, the timing can absolutely affect bowel movements. So again, that's something where some experimentation, I always recommend journaling because it's hard to keep track of these things as a mom or a parent. So overall, journaling to write down what changes you made and how it affected any symptoms that they might be experiencing, like nighttime bowel movements, and some experimentation with timing can be really helpful with that.
Right. Okay. Wonderful. Thank you, Bradie. Um, so we've kind of gone over, but that's okay. Um, I mean, if anyone has any specific questions, they need a bit of guidance, support, feel free to reach out to Bradie or myself. We are so happy to answer any messages and help you with your unique situation.
Yes, yeah, amazing. Absolutely. There's a ton of information that we could talk about all day, Rosa, especially just between sleep and nutrition. Like there's such a connection there. So exactly, if anyone has questions, just feel free to send us messages. We're happy to provide support, answer questions, or connect you with any resources as well if it would be helpful for you. So feel free to send us both messages. And if there are other topics, if you enjoyed this and there are other topics that you might want to hear from us on, feel free to let us know as well. And then we can make sure that we answer questions maybe in our next Instagram Live.
Yeah. And thank you to all of you that joined live today.
Yes, thanks everyone. It was so great to have you all. And feel free to send us messages as you'd like.
Okay.
Okay. Bye. Bye. It was nice chatting with you, Rosa.
Take care.